medications are truly not the most benign option among the options that we have. If we think about all the side effects that medications have and the cumulative effect of these medications, because it's for many, many decades, sometimes that our patients have to use these medications and definitely more than one, then we start to understand that perhaps that's not the best way. And also another important thing is sometimes we as doctors might feel that the patient is happy and tolerating that medication when in reality they're not. But they have no idea that all the symptoms that they hate and that they're feeling are secondary to the medications.
Yeah, and I think, there's an assumption that we make that patients on medications are stable, right?
Yeah,
and I
right.
think I like to teach glaucoma in that there's no such thing as glaucoma stable, really. And we need to operate on an assumption that glaucoma is getting worse and prove it that it's not. And that's kind of a first mindset thing on that.
Well, it comes to heart and soul of what is the definition of controlled glaucoma. We now have so many good data sets from the LIGHT trial, Horizon trial, and other trials that show us that even despite the same level of IOP reduction, when someone is off medications versus on medications, they have less chance of progression, less chance of needing secondary surgeries, etc.
And they are much happier.
And they're much happier. Quality of life is also improved.
And ocular surface disease is playing a big role.
Absolutely.
And
Let's talk about OSD. That's a big deal.
If you can take patients off drops or fewer drops, they love it. And they are willing to undergo a procedure for that as well. I think most of our patients are willing to do that.
And that is a key. Now with these minimally invasive surgeries like the canaloplasty devices, etc., the high safety profile, now we don't have to wait till they're obviously progressing, obviously have high pressures. Just merely a patient not happy with taking a drop is enough to say, yes, let's go for it.
And I think a canaloplasty is an excellent first choice. You can combine it with everything. And you can even place a stent afterwards, so you can go to a MIGS procedure and you can do a trap or two, whatever. So it leaves you much of opportunity because it does no harm to the tissues.
Yeah, pushing that down the road and less drops, less conjunctival scarring.